Thanks. Okay, good morning. I want to welcome Omni for attending this press conference. Today is United Nations Day, and in 1945, on October 24th, the UN was born, and the mission was to bring countries together and address the world's problems. In the spirit of UN's vision, this morning I am making an announcement to address one of the world's problems, and that's the world organ and tissue donation shortage. Organ transplantation is relatively a new but very successful medical practice. It was actually in 1912 when Dr. Alexis Carrel was recognized with a Nobel Prize for his pioneer work in this area. There was actually no transplantation that were actually done during that time, but he had the vision and foresight to make it happen. The good news is that for the past 25 years, millions of people benefit by having their lives saved and living healthily afterwards. The bad news is that there's probably about 1 million people waiting for organ and tissue donations throughout the world, and every other minute someone is dying in need of these gifts. So as we go through this press conference, there's probably 15 people that are going to die because they didn't receive an organ transplant. This issue needs a global stage to bring the much needed medical technology and awareness, and then I believe that we can solve this problem worldwide. This morning I am introducing step-by-step 7th campaign, and that the name of the campaign is SOS 1 Million, the World Student Torch Relay. I would like first to shed some background on step-by-step and my personal role in it. In 1992, I found out that I had terminal liver disease and had 2 years left to live. It was during this time that I started devoting my time to organ and tissue donations. Every day I would try and learn something new about this issue, and I was determined to find out as much as possible in Canada and worldwide. In 1994, the world and myself found out about Spain's successful approach in addressing this issue. I have been impressed with Spain's system ever since. I was fortunate enough to have a good general physician during this time, which led me to excellent care and in me eventually receiving a liver transplant in 1995. It's at this point that I want to make another point about this issue. There are presently over 4,000 people in Canada that are waiting for organ transplants. And from all my experiences since 1992, I have determined that the number is probably 10 times that amount. And so what I'm saying is that there's probably close to 25,000, 30,000 people that should be on a waiting list as candidates to receive organ transplants. And I'll give my reason for this. I know how hard it is when you are told or you're told that you have some serious disease concerning one of your organs, and getting treated for any of these diseases is based on what kind of healthcare system we have here in Canada. Now, our problem is that if you're seeing a general physician, the wait time is extremely long before you see that specialist that you should be seeing, and the nature of your disease won't be probably diagnosed, and you'll probably never know that you could have been a candidate to be a candidate for the organ waiting list. And we have to look at our numbers. There are close to 100,000 people that are dying every year of heart-related diseases, 60, 70,000 people that are dying of diabetes, and close to that number of people that are dying of cancerous. And then there's other smaller figures of numbers of people that are dying of organ-related diseases. Now, how could it be that all these people, were they all notified that at one point or another maybe they could have been on a waiting list? And I think we have to look at this very seriously, because my belief is that instead of 44,000, I think there should be more closer to 25, 30,000 people that should be on this waiting list. So getting back to where I left off, shortly after my transplant, I created Step by Step, a charitable organization. I humbly walked about 15,000 kilometers in total, from the first step that I took in 1997 in the first campaign to 100 million steps, and recently my sixth campaign in 2008. I and many volunteers brought this issue to the forefront by reaching the public, media, and government and making them aware about the importance of organ donations. During this period, we visited over 500 communities, and during this time, we participated in over 4,000 activities, including press conferences, provincial and federal health committees, school assemblies, church gatherings, community events, etc., etc., etc. Every day, I personally have engaged in countless debates, consultations, and research regarding this issue.